that's what connects them and keeps them motivated. So I would let them know this is not for the faint of heart, right? This is very hard work. It consumes you. To be honest, I feel that as a principal, you feel accountable for all of your faculty, all of your students, all of your support staff, all of the time. So if something happens to one of them on a Saturday afternoon, you're gonna feel the weight of it. If it happens on a Sunday morning, you're gonna feel the weight of it, whether or not it has to do with school, right? It's almost like just being connected to everyone at the same time, which is a lot. At the same time, it's a beautiful thing because people will also share their joys with you at all times. So it's a great opportunity to really set the conditions for things to go well. But there's also a lot of accountability that comes with that. So learning how to balance that is something that I continue to work on, right? So that it doesn't overtake me one way or the other. But it's really, I feel very blessed and very entrusted to assume that position. It's a job.
Thank you, Madam Chair. So board members, this morning, this is a workshop that was requested by the board, and this is a Medicaid updates, and this will be done through our finance office. So again, this is a requested workshop by our board on updates around Medicaid. So what this workshop will look like is we'll spend the first 15-20 minutes just kind of providing an overview of Medicaid, and then after that we'll move into some discussion around that, and of course, like all of our workshops, to provide some direction around this to myself and Mr. Lewis, our Chief Financial Officer. So I'll turn this over at this point to Mr. Lewis, our CFO, who will introduce his team. Mr. Lewis?
All right. Thank you, board members and Superintendent Ayers, for this opportunity that finance can come talk to you guys about what is our Medicaid program. And we're going to take this next few minutes just to introduce what Medicaid is here at our district, which is a little bit different than maybe what you think, and the multiple programs that we have, and then talk about some challenges and some opportunities that we have with it. And so I have a lot of my staff here that can answer questions later on, but I do want to introduce what I'm calling our Medicaid expert, in Ms. Deneen Grisani, and she is going to be helping us today with working through this presentation, and then we'll be welcoming some questions at the end. Okay, so Ms. Deneen, I'm going to turn it over to you.
So good morning, everyone. I appreciate this opportunity. I'm extremely happy to be able to present to you and to tell you about our Medicaid program. My experience, I think, is important because I worked for Broward County Schools for about 28 years before I came to Hillsborough 3 years ago. And so while we were in Broward, the last 20 years, I worked with the school-based Medicaid. So I've been in this industry for many, many years. So now I'm at Hillsborough, and we want to present to you and let you know about what's going on with the bigger picture of Medicaid, what Medicaid is. We want to tell you about the Medicaid program itself that we have within Hillsborough Schools, and also the policy changes that are going to impact us, as well as what are our next steps? What are we going to do to make this program successful? And also what type of support that we need from the board. So let's talk about Medicaid. So what is Medicaid? Medicaid is a low cost or free health insurance for families and children. It covers all medically necessary services. Almost 40% of the U.S. population are covered by either Medicaid or CHIP, which is Children Health Insurance Program. They also, Medicaid is the fourth largest funding stream for schools. Everyone can hear me okay? Okay. And also Medicaid supports about $7.5 billion as money for school-based services for the school districts across the United States. So what is Medicaid? And so we have Medicaid in schools now. So Medicaid in schools, according to the Centers for Medicare or Medicaid, and that's CMS, according to CMS, school districts have a unique opportunity to be able to access students. So this is the best place for us to have these Medicaid programs. We're able to enroll our students in Medicaid, we're able to provide services for them, and we're able to have them give them access to those services. So Congress approved this, and also then the Florida legislature also enacted some rules around it. So we have two Medicaid programs here in Hillsborough County Schools. So those two Medicaid programs are the Medicaid Certified School Match Program. So that's the program where if I'm a speech pathologist and I see Johnny for 30 minutes, I provide Johnny his speech therapy, I document those services, and then our department takes over and submits those services. So that's one program that everybody is pretty familiar with. The other program that we run here in Hillsborough County is a time sample. So what we do is am I on the wrong slide? So the Medicaid school district, we have the SDAC program. So we focus on outreach to students, and we help them get their school-based health services. So it's a shared partnership. This Medicaid program is a shared partnership between the federal and state government. And how is that, what does that partnership look like? We have a state plan. So the state plan details everything that we're allowed to do. And so with that state plan, if you ever want to make changes to that, and when I say you, I mean the state of Florida, If they ever want to change that state plan, then they have to submit a SPA. It's a state plan amendment, and currently it takes 15 to 18 months to get a SPA approved. And that's really important that you'll hear later on in the presentation about this SPA. So where do we start? So we start with enrolling students in Medicaid. So how do we do that as a school district? So the school district has a memorandum of agreement with the Family Healthcare Foundation, and we've had that agreement for at least the last 10 years that I could tell. So we work with the Family Healthcare Foundation to get these students enrolled, and we also work with other departments within the school district. We are working with FACE for the community. We're working with the ESE department. We're working with the finance, student services. So this isn't just a one department program. It interfaces with many, many, many other departments within the school district. And so we have this memorandum of agreement with the Family Healthcare Foundation. And so what do they provide for us? Well, they have all the knowledge. They know how to enroll students in Medicaid. They are able to educate and educate our parents and our families. They have toolkits and media toolkits to be able to bring out to the schools. They go to our open houses. They have Baycare Navigators, which are a mobile medical bus. So they're able to go to all the 7 sites for the Children's Board and enroll these students. They screen them and then they enroll them. And if they don't enroll them in Medicaid or CHIP, Children's Health Insurance Program, then they'll find a low-cost health insurance that they can afford that will meet the family's needs. So we partner with them and as well as other departments within the school district. What are the eligibility requirements for students? So they have to be a U.S. citizen, qualified immigration status. Your income, they look at how much money you make or don't make. If you're a pregnant woman, they pay for the services if you qualify of having that baby. Also, we have families that have a lot of high medical expenses, and they can apply for a Medicaid waiver. So those are the qualifications to become Medicaid eligible. And we'll go a little bit more into that in a bit. But in Hillsborough County Schools, I estimate that we have about 8,000 Medicaid eligible students receiving services. So we can have Medicaid eligible students in the district but aren't receiving services, so there's no reimbursement. So that's where that 8,000 number comes from, because they are receiving, and that's ESE only at this point. So immigration status, I'll go over this real quick. So it's the qualified immigration status you have to have. But I also I thought it was important for you to know that we also have programs for children under 19 for emergency medical services. And the children, regardless of the immigration status, may be eligible for CHIP under the Affordable Care Act, which provides access to comprehensive health care services. And so we're going to take a look at the income limits just to shock you a bit. So this first slide it tells you about age groups. And I'll really just go to the second slide to save some time and look at the annual income guidelines. And so if you look at a family of 4, they can't make more than $42,760. They make $42,761. They're no longer on Medicaid. Maybe they can get CHIP. But they don't qualify for Medicaid. And there's other requirements as well. It's not strictly income. So that was just so you had a little bit of information on that. So why are we unique? Why is the school-based Medicaid program different from the community provider? Well, there's at least two reasons. And one of them is that we get paid differently. We get reimbursed differently than, say, a hospital or a doctor's office. So how do we get reimbursed? We get reimbursed through time samples. So we ask, what activity were you engaged in at a specific moment in time? So for example, on April the 11th at 2:11 p.m., what were you doing at that moment? That can bring in a significant amount of reimbursement to the district. And then the second program is direct services. So it's the same thing you're used to seeing. You know, I'm a speech pathologist. I see Johnny for 30 minutes. I document it. He's Medicaid eligible. I have parental consent and some other compliance checks we have to do, and we submit it and can get reimbursed for that. So 2 programs in the Hillsborough County School District. And then the second other difference is consent. We need parental consent to be able to bill for those services and also to release information to the entity, the Medicaid entity. So let's get into details. School District Administrative Claiming, that's program number 1. Like I said, we run 2 Medicaid programs. The first program is the SDAC, also known as School District Administrative Claiming, or Random Moment Time Sample. You'll hear me say RMS or RMTS, and it's truly random, and it's a moment in time, like I showed you, it's 2:10 p.m. And so what do we get reimbursed for? We get reimbursed for seeking out, identifying, referring, monitoring, training, and learning. So these are the things, the activities that we're trying to capture from our staff members of what you are doing at your moment in time. So if you're doing one of these activities on the sheet, then we can get reimbursed for those activities. So let's dig a little bit deeper into the program. So what happened? So we have 4 quarters, and we sample our participants, meaning we survey them every quarter. So how many people? There's about a pool of between 3,000 to 3,500, depending on the quarter, are in the sample pool. And out of those people every quarter, we select about 80 to 90, depending on stats. And this, we participate in the DOE's program, so they really do most of that part of it. So it's about 80 to 90 surveys that we do every single quarter. And we ask the staff 3 questions. You ready for this? Who are you with? What are you doing? And why are you doing it? 3 questions. A significant amount of money. So staff members are not told the date and the time of their time sample until the day they are sampled. That will change in 2026. You'll hear me talk about that in a minute. That will change to, they'll get 2 days notice. So we can tell them 2 days in advance that your moment is going to be April the 5th at 2 p.m. Right now, they get a notification at 4 a.m. in their email, and we ask them 7 days in advance to look at your email every morning and wait for that moment. And then they'll know when their moment is. They'll get that email says your moment's today, it's at 2 o'clock, and it'll give them the instructions on what they have to do. So the staff members that participate in this program, they cannot be 100% federally funded. The Medicaid, and then once they reply to the surveys, the Medicaid team codes these surveys based on the guide that we have, and based on the codes, we get reimbursed. And the current participation rate, we have to get back 75%, although our goal is 95 to 100. We always want every single one back. But in 2026, they will be changing that to 85% participation rate. So and also they have to return their forms in 2 days. Today it's 7 days. So it's going to be a bigger challenge come 2026 to get those time samples back. So who are we sampling? Who participates in these programs? So on the right side, on the left side of the screen, you see your direct service providers, and on the right side, you see like ESC teachers, ESC specialists, principals. This whole group are included in the time sample. So it's about 3,000 to 3,500 staff members every quarter, who's ever in those roles for that quarter. So that was the SDAC program. That was program number 1. It's a time sample, 3 questions. We code it. We get reimbursed. I wish it was that simple. School Medicaid program number 2. So this program is a fee-for-service program. Many of you have heard that terminology, fee-for-service. We provide a service. We charge a fee. So what are the requirements of this program? So we have to have parental consent. There has to be some type of a plan, a treatment plan, an IEP plan, a health care plan, a positive behavior intervention plan. There has to be a plan for us to get reimbursed because, of course, Medicaid, the next requirement is they want documentation, right? So we have to have those things as a backup for documentation. And we also have to have approved providers. So our speech pathologists, they have to have certain credentials. Our psychologists, they have to have certain credentials in order to participate in these programs. So another part of this fee-for-service program is the direct services to students, right? So what are those categories that we get reimbursed for direct services? So we get reimbursed for mental health services, the services we provide for counseling, or all the evaluations that we do. We get reimbursed for nursing services, medication services, therapies. We get reimbursed for speech language, OT, PT. And also, believe it or not, we get reimbursed for transporting students to school and home from school. Nobody thinks Medicaid has anything to do with transportation in the school district, but we do. And our transportation department is doing a phenomenal job capturing those rides on the bus. And so if we transport a student to school and they have a service that day, the nursing service, and we transport them home, we get to bill them for two services, for the ride home and the ride to school. So it's important that those services are in the system and documented, because we would not only lose the service, but we would lose the transportation reimbursement as well. So which staff members participate in this program? So you'll see it was just that one slide, but these are the people that have a DOE certification or a license. And it also includes contracted staff. I want to mention that because we have quite a few speech language pathologists that are contracted. However, they are required to do the same thing as our school district employees regarding the Medicaid program. So our fee-for-service rate schedule. So what do we get reimbursed? How much is it? So the state Medicaid agency reimburses school district based on a fee schedule. These are rates from like 1997 out of the 2005 Medicaid handbook. And the fee schedule lists types of services. For example, we can get reimbursed a fee for a psych evaluation that we do for our students. So that's how we get reimbursed based on a fee schedule for this program. So the next slide is certification of public expenditures. And so I'm going to read it to you, but this is really important that you understand this, because this has been a challenge for us, and this is where we are out of compliance. So what is the certification of public expenditures? So every time I submit a claim, we have to sign this form. And what does the form say? It says the school district has expended the state share of public non-federal funds needed to match the federal share of medical claims billed to the state Medicaid agency for school district services provided to and on behalf of eligible Medicaid students with each quarter's claim. So what does that mean? Basically, it means we get reimbursed for what our costs are. So if it costs us $10 to transport one ESE kid to school, then that's our cost, and that's how we should be reimbursed, not on a fee schedule. So this has been, well, let's go to the next slide. So we have been out of compliance along with these other states as well. We did some research, and there was in 2022, the Healthy Schools Promising Futures, who is a partner of ours, who really advocates for school-based health services. They did a survey, and there's 5 districts, and I know, or states, and Florida is still out of compliance. So in 2014 is when we went out of compliance, and since then, we have not been paid the way that we should be being reimbursed. So here's some just recent events, gives you some dates how we got to this place where we are that we're out of compliance. So, and there's it's under the Code of Federal, 45 Code of Federal Regulations. And then what does it say? Why are we out of compliance? Because we received a letter in 2020 from the federal government to the state government saying the school districts may not be paid from a fee schedule and use this as a certification of cost. So that was the CPE, per Beth Kidder, Deputy Secretary for Medicaid in 2020. Now, we have some talking points in the back that we didn't want to take the time to go over all of that, but we did create a one-pager for you as a resource to understand a little bit more in depth of what is happening. So in 2019, AHCA, the Agency for Healthcare Administration, who is our state Medicaid agency, they submitted a SPA, and CMS approved the SPA to add non-ESE students. So we're now able, since 2020, to be able to capture services that we provide to students that are gen ed that are Medicaid eligible that are receiving services. So that's been since 2020, and I can tell you that Florida is way behind in all the other school districts in creating this infrastructure to be able to document and get reimbursed for that. So in 2019, we submitted the SPA, the state did, for non-IEP services, and also to include charter schools and private schools in the Medicaid programs. In 2020, the governor signed it into law, and then also in 2020 is when we received that letter that I spoke about, the companion letter that was sent to Beth Kidder. And then in 2023, we received a 184-page guide, a new comprehensive Medicaid guide from the federal government. So these are all the federal rules. And so in order to be in compliance with these new federal rules that came out in May of 2023, they have to be implemented by July 1st, 2026. We have to have a SPA approved, because they're going to pay us based on our expenditures as opposed to paying us based on our fee for service. So in order to get paid that way, we have to submit a SPA. Have we done that, knowing that it's 15 to 18 months that it takes to get one approved? No. The state of Florida Agency for Healthcare Administration has not done this yet as of today's date, and we are very much paying attention to what they are doing. An initiative. So that's the programs that we have, that's part of the problems that we need, and these are our initiatives that we're going to go after. We want to bring a campaign, and it starts today, bring an awareness of what we can do for our schools. This isn't for Hillsborough County Public Schools. This is for our kids, because they need to be enrolled, they need to have insurance, and we get reimbursed for expenses we've already paid. So we're already doing the work. I'm starting to get passionate. Okay. And we're collaborating with other departments, like we're collaborating with FACE. We work with social workers. Myrna's here today. I'm so happy to see that. Student services. So we work with all the other divisions. We're going to have community engagement, and we have to create efficiencies. Thank you for hiring Jamie. Seriously, we are going to make this work. Our data reports are going to be better. We're going to create a better process flow. And so do we want to wait until 2026 to get that extra dollars? Not if we don't have to. So what we have decided is we are allowed to do a rate study. So I spoke about transportation earlier, being able to get reimbursed for transportation. I don't even want to tell you what our rate is right now, how much we get for transporting a student to a service. But we do know that there's the opportunity to do a rate study and increase how much we make. I know Levy County just submitted one for $19 a ride. I did it in Broward County, and we went from $3 to, I think it was $13 at the time, something like that. So we're going to do that here, and we're going to do that with other nursing and occupational therapy and for the other groups as well, to see how much we can increase the rates. We'll never get what we spend. They'll never come to that point. We have to have that cost reconciliation program implemented by ACA. But in the meantime, we're going to try to maximize our reimbursement. So the board support. So just having you sit here listening and understanding what I'm saying is huge support, because now you can speak about it. You can talk about it in your circles. You could speak to your state reps about it. But let me stick to the script. So we can increase the budget for school-based services. So in order to get this extra estimated $200 million for Florida school districts, our budget right now is $100 million. So ACA has to request a $200 million increase. We've yet to see that. So we need to support that increase. You know, usually we don't want to support budget increases, but this is this is federal dollars. It's not even state dollars that we're getting. It's federal dollars. We need to have ACA submit and get a state plan amendment approved. And we also need to develop an interagency agreement to determine between the state Medicaid and Department of Education. By law, we are supposed to have that. We do not. And we need to know whose roles are what. We work very closely with the Department of Education. They have a team up there that helps us. And so we just need to work with them and have an interagency agreement between the Department of Health and the Agency for Healthcare Administration. That's really it, what I went over today. I hope you all learned something, and I'm ready for your questions, or he is.
Thank you so much.
Thank you.
First up is Member Perez.
Thank you. And I really appreciate this. As you mentioned, you know, in my other life, we do bookability. So, you know, to demonstrate, like you mentioned, what we're doing at a certain time, you know, at a certain date, to be able to secure those Medicaid dollars. So that, they do that in any venue, that collects Medicaid dollars. How much do we bill currently?
How much do we bill? Are you saying how many services, how much money?
How much money do we collect?
So we have two different programs. So the one that's the direct, so last year we brought in about $6 million we brought in last year.
Correct.
Yep.
And how much should we?
Well, there's different estimates, but we believe that we should be bringing in at least $10 million more annually.
And just for clarification, that's if the new policy is adopted by the state of Florida.
Yes.
And so if that was to happen, almost automatically, for the same level of work that we're already doing, that money would just inflow to our district. Until then, and as you heard, the SPA takes quite a bit of time. And if you were to count the months from now until July of 26, we've already passed that time period. And so because of that, and through previous challenges with the state being out of compliance, we're going to start the rate study. So hopefully we know where we're at now. We have a threshold, and we'll start to see that trickle up because we're going to do the rate studies. We'll never get to where we want to be because we'll never be able to do enough studies to maximize that. But we're going to try to do our best to do more than we're doing now. And Ms. Deneen has experience in another county where they did that and saw some real gains in a very quick manner. So.
Yes.
So it's really important for the mental health professionals and all of the professionals in the school system to complete that Medicaid billing correctly.
Yes.
Because it ensures that the schools receive that proper funding, but also the proper Medicaid billing helps to maintain compliance.
Yes.
So it's a two-sided coin, correct? Compliance with regulations and guidelines.
Yes.
In order for us to be in compliance.
For sure, yes.
So, codes. Who once that Medicaid billing is completed, who codes it?
So for the fee-for-service program, well, we don't code it. We just check compliance. So we have a vendor that I used to use when I was in Broward, and I was happy to see that Hillsborough used them too. When I came here, it just made it so much easier for me. And they are our documentation system, and then from that, we check compliance. They have compliance checks, and then we submit it to Medicaid. So we check. Yes, very important.
For us to get reimbursed.
Yes, yes. We don't want to submit anything we're not supposed to.
All right, I'm gonna get back to you.
All right, thank you. Next, we have Member Gray.
Thank you, Madam Chair, and thank you, Deneen and Jamie Lewis as well. Learning a lot, and thanks that you're having a rate study because that's going to be very important. You know, I always look for the silver lining in the clouds, and I know Kristen Davis is not here or up front to mention the recent legislation, but in real time, we're looking at lowering the reimbursement tremendously. And why I ask for several reasons. The first thing is, as Member Perez alluded to, we use some of that reimbursement for salaries, right? Mental health for some of our staff members, the salaries. Is that correct?
I'm not 100% sure.
Since this is a true reimbursement program, it goes back to the general fund where
That's
those funds are. But I guess you could say it underlying helps the district provide these. But I think what's really important is whether we get this reimbursement or not, these services will always continue. And so I don't always link the money right back to reimbursements of the salaries because we're going to do this regardless for our students. It is nice to get reimbursed because that helps. But just to ensure everyone that we're going to continue these services for these kids, whether we're reimbursed for these services or not, because that's a commitment that the district has.
Yeah, and so we have like a, a column here. Yes, you're going to do the right thing for our children. The other reality is if it minuses the general fund, there will be other consequences to employees of our district. We're talking about a loss. And how much do we anticipate, and you mentioned technology-assisted devices, transportation for ESE, they're very costly. Do we anticipate any losses to help those programs or, to help those ESE kids who have tremendous disabilities through this possible time of deficit?
I don't believe the kids are going to be impacted too much. I mean, there will be a change, but my personal belief is probably optimistic that they're still going to take care of our medically fragile and our students that are ESE.
Okay.
But I would say, I think like any change that might be coming for our district, it's something we need to monitor and work closely. And I think one of the points that Ms. Deneen mentioned is something that finance is doing now is working very closely with other departments. And so Ms. Tracy Brown is here, and we've already reached out and worked with her. Even before I got here, Ms. Deneen was working with her to build those better relationships, because that's a key partnership, understanding what's happening in the schools and the services we're providing, and making sure we're seeing that on our end, at the back end, and the district is collaborating, working together to ensure that we're maximizing both the care for our students and this program.
Yeah, and that is so true. And your presentation is very much heartfelt and appreciated in every way possible. But the reality is, and when we look at the school-based Medicaid and loss of federal reimbursement we only go down to May 2023, but in fact, we're looking at 24, 25, 26, where we will get less reimbursement. And hence, you're getting into the rate study, which is important, no doubt. But that reality will affect groups of students, not only the ESE, but what other groups do we have that will be affected if we have to endure more cuts to Medicaid?
I don't think that we're going to have cuts. Maybe I'm just in this program. In fact, we're supposed to increase our reimbursement because we haven't been paid at the right rate for all these years, and we've been out of compliance. So if we can get the Agency for Healthcare Administration to do their job and submit a SPA, and we could start getting reimbursed based on our expenses, which are way more than what we're getting reimbursed now.
Yeah, expenses are outweighing what we are getting reimbursed, hence
Yes.
that's a deficit. I'm not a Debbie Downer, by the way, but I have to say, from what I'm reading in the legislative, as things are coming down, yes, Jamie?
Yeah, I was going to say, I think to your point, Ms. Deneen mentioned that the state of Florida needs to request to the federal government an increase in budget. And that's a number to watch. And so if that increases, then that allows districts to receive more money. If that number was to decrease, to your point, I think that's when districts might be negatively affected with their reimbursement program because there's just less money to push out to the districts. And so that budget's a really important number at the state level because with all the changes that are occurring, how that number fluctuates will determine, what happens at the district level for all districts in the state of Florida.
Yeah, and I was looking at Orange County. This is a topic that's not just here. It's in other counties that they're very aware of what may be seen as a tremendous deficit, which then minuses from our general fund, which then affects many, many things. And Tracy Brown, I don't have to tell you, but your Title I, Title II, Title IX also affected. I'm going to just ask one more question. So ESE may be affected, let's just say maybe. And then we have what is called FACE, Family and Community Engagement, which interfaces with families who are very, very aware of what may be minused in their incomes for if they're on a Medicaid, should I say program or Medicaid? Okay.
Yes.
So how, and Superintendent Van Ayers, where would FACE be used to help our families navigate what might be new ways to get reimbursed? And I'm speaking.
Yeah. So
Not as a
as part of
Medicaid
our
expert.
family and community engagement, I mean, this is an opportunity for them to be out in our communities, of course, and inform and educate our families around these Medicaid opportunities. So Jamie's team has been working with Owen's team and making sure that we are out in certain segments of our community, because I think it's pretty targeted at which communities that we're looking at, so we can inform and educate them around that Medicaid enrollment.
Okay, and I said this is the last question. Let me just squeeze one more in.
Yeah.
Many of the groups we have Hispanic, I'll just point that out, which may total 48% student. Many of them are facing or looking at possible Medicaid functionalities being decreased. So one of the problems that we're facing is the digital part, and this is not, Janine, you can't fix this, but the reality is our Hispanic folks, and many don't even know how, I hate to say it, but many don't even have a computer. They don't have the wherewithal to navigate intricacies of bureaucracy. How are we prepared to help them?
So we have the memorandum of agreement with the Family Healthcare Foundation. In fact, they're here today, and that we're a partnership with them. So they have the people that are trained, and they also have it in different languages. They have media toolkits. They go out to different sites. They are well trained and well educated and know how to enroll our families, and they go out to different events to enroll our families. So we're going to get more into that and make that a bigger priority, because we know that the kids need insurance and we want them to be enrolled and we benefit from it, but really it's getting them insured.
Thank you
Yes.
for everything.
Yes,
Thank you.
You're welcome.
Thank you, Member Gray. Dr. Hahn?
Thank you. So in 2020, the letter came out that said no more fee, you couldn't use a fee schedule. Why do you think, since then, the feds haven't enforced the 5 states to comply?
Because they have no teeth. So we've spoke with them. They don't have, the Centers for Medicaid and Medicare have no teeth, basically, is what they say. They cannot enforce it, but HHS can. And so we meet with CMS quite often. And the last time we met with them, we asked them, like 5 different counties, Pinellas, Leon, Hillsborough, Broward, we all went up to them separately and said, what can we do? We have to move, we have to have them do something. Should we call HHS? And he's like, well, do you want HHS to come in and look at your program? You know, that's a decision the school districts need to make. I don't think that we're there yet. I think we have other avenues, like speaking to our lobbyists and working through Kristen Davis and trying to get them to do what they're supposed to do.
Okay. And so you talked about doing a rate study. Is that something we would hire a consultant for, or do we do that internally?
We're going to do it internally.
Okay.
Yes.
Okay. And then we also talked about our current participation rate. I think you said the goal was, what was your goal?
95 to 100%.
Where are we in that rate?
95 to 100%.
We are in
Yes.
that- within that, okay.
1 month it went a little lower. I lost a person that had been doing it for many, many years. She went out. She retired, but we're getting back there again. So it's about 95 to almost 100%.
Okay.
Yeah.
All right. Thank you.
Yes, you're welcome.
Thank you, Dr. Hahn. Member Combs? Dr. Hahn, I think I said something else.
Thank you, Chair Vaughn. I had a couple questions. Thank you for the information. You know, there's just so many factors. As a board member, it's like we don't know everything, and so this is just something I've learned a lot about just through reading this folder. So I guess one of the questions is, what would the states actually have to do, or our state in particular, what do they need to do in order to be compliant?
So what we need to do is a few things, and we can't do any of it, so it has to be.
I mean, what would the state have to do?
Yes, the state
Just
Medicaid
so people to
agency.
lobby.
What they have to first do is submit a SPA, so
Yeah.
they have to
Yeah.
change it. So the SPA would say, we're no longer going to be paid on a fee schedule, we're going to be in compliance and paid based on our expenditures, and then they have to come up with, what does it look like in reality for us? And so what do we have to do differently? We're going to have to do cost reports, we're going to have to, that survey I told you about, we have 3-question survey. We're going to have probably 2 cost pools instead of 1. So it's going to be a little more work, but it'll definitely be worth it. The work will be mostly internally, not so much on the staff at schools. So that's what we would have to do too. We would have to submit a SPA, and then after the SPA is approved, then they have to promulgate the rules. They have to have a rule-making hearing, and they have to get that approved. And that's going to be the rules that the state of Florida has to follow.
And do you anticipate that happening?
I anticipate it happening at some point. I do not anticipate it happening by July 1st, 2026.
So it's been like 7 years, right, that we have, 2020, since we have been in compliance?
Well, originally it was 2014, but the guide came out, the new federal guide, in May of 2023, and saying that the whole state, not just Florida, the nation, has to use this new guide by July 1st, 2026. And most school districts, we have national conferences and national calls, so I feel confident I can say this. Most school districts are doing what they need to do because they know how much money it brings in. Like New Mexico is amazing. Some of those other, Denver is amazing how much money they're bringing in. By doing a cost reconciliation instead of paying, getting $3 for providing Johnny a speech therapy. So it's definitely going to be better if we can get the ACA to do what they're supposed to do.
But to clarify your question even further, I think it's been issued several years ago, and the timeline, in that timeline that the federal government approached getting into compliance for the state of Florida, that was an appropriate timeline if they would have started right then. I think the reason we're going to do a study on several different areas is because we haven't seen the traction where it needed to be in the timeline that it needs to be. I think we would say that doesn't mean that nothing is happening. It's just not happening at the pace needed to hit the target for 2026. And so the question would be is when does the state of Florida adopt it? I would assume that it has to eventually. But in the meantime, we don't want to wait to that date because that puts us further behind. We believe we can do self-studies here in Hillsborough to at least get a better rate until the time be that the state of Florida does become compliant.
Yeah, and I'm surprised I haven't heard more about this from the Florida School Board Association, because I think this is something, huge, and it could impact all these districts. I'm surprised that I haven't heard more about this, because I always read everything they have. Yeah, I mean, of course they'd be aware, and I would think that we would, make sure we utilize our lobbyists, and we would use it as a priority, one of our priorities for next year. So I'm just surprised that I feel like I'm very involved, and I don't. Thank you, Member Perez, for bringing this to us. I guess the other questions, I have a couple. I guess one of the goals is the outreach. And do we do something on those first day packets for the outreach, for the information? And then the other thought would be on our district website, but definitely on individual student websites, when that's going to be a high area, looking at those individual websites and having those first packet days to just think about how we can reach out. And then I think at events, right, when I think about the different events that we have, there should always maybe be a table out there just to make sure that we're, registering families and providing that.
Yes, agreed.
We think there's
Yeah. Is there a registration period, or is it any time? Is there an enrollment period, or is it open anytime?
Yes.
So, I would think it's some events that we go to, like the Race for Education, anything that we do, that's going to have a lot of families there, parents there, going out there, just giving that information and getting the parents to
We
enroll.
think that's why it's key for several units inside the district to be working together on this project. It's not
Sure.
just a finance-led. And so we've been partnering with other ones, as we mentioned earlier in this conversation. Mr. Owen and his group would know best of how to engage. And I think the one thing we want to do is make sure families feel comfortable with what we're trying to do with the Medicaid program. You know, sometimes families are hesitant to sign up for programs because they're just unaware of what it means. And so we want to make sure they're comfortable. We want to make sure our guidance counselors and our principals are educated where they can talk clearly about it and help explain that, because they'll be in those conversations with the parents where maybe we don't see them all the time. And so it's going to be more than just community. We think internally we can do education and build up our staff to feel confident about talking about it and the benefits of what this does. But the reality is we want to make mom and dad feel comfortable with what this program is, and to make sure they're reassured that their child will always receive the service, and what does this actually mean and impact them, or doesn't, maybe I should say, doesn't impact them.
And I think creating some type of video for the communication team with like multiple languages and sharing that, because sometimes it will be the data processor, the front office staff. When people come in to register in the middle of the year, often the front office staff is knowledgeable and provides that information, or the parent community center, places like that where parents are going, just to make sure, because I think if we can, everybody, all hands on deck, I think we can even make a bigger impact.
Yeah.
Okay, thank you so much.
Thank you.
Thank you, Member Combs. Member Washington?
Thank you, Madam Chair. I just want to reemphasize, because we all had great points about the program, and thank you all, because I'm not that familiar with Medicaid, and I think what we are doing now to improve is going to be successful for all families. The recruit part, like Member Combs said, and Member Gray, it's so important to get in those neighborhoods that we don't normally go into. Because we do have great divisional divide in those neighborhoods, because they don't have computers, in parts of East Tampa, we don't have that. They don't have the information. We don't have anybody out there. And I think FACE would be so important, or any of us. I mean, I'd be willing to go out in the neighborhood, because that's where I was born and reared at. So it would be real important for us to get out there, because families, it's not necessary that they don't want it. Sometimes they don't want to be embarrassed.
Right. It's true.
That's a key point. Because many a times when I was a principal, when we did Title I or whatever we needed, they didn't want to put their names down because they was embarrassed. So we got to find a way how we can get them out and to improve that, and also explain it to them in detail. Because, we understand, some of us, we understand, but when you go out talking to people, and some people don't have education, I mean, they just don't know. So you got to break it down in simple terms so they'll understand. But I thank you all, and the board members had some great points they brought out, the things that we would like to see done. Okay, thank you.
Yes,
thank you, Madam Chair.
Thank you. I'm just going to ask some questions, and then we have some second questions back in the queue. First of all, thanks for the presentation. My favorite thing is, what can board members do and board support, right? Like, I love that, because it gives us an idea of specifically in our roles what we can do and how we can advocate. So that piece, I mean, it's all helpful, but that piece is specifically helpful.
And just to follow up with that, there's a sheet in the back of your folders that we mentioned in our presentation. We kind of gave you a one-sheeter that kind of gives you more details. So if you need to pull something out, you have that readily available, so you don't have to look through the whole presentation.
Thank you, Member Perez, for bringing this forward so we could be educated about this. One of my questions was, I noted, I remember I wrote down that you said 40% of our families participate in Medicaid. Is that in Hillsborough County, or is that statewide?
That was statewide, but it's actually the same. It's a little bit less in Hillsborough County. It's like 39%.
So just to kind of take what you've presented, 40% of our families, which is almost half, live under a rate of, for a family of four, bringing in $45,000 a year. Like, I think that's a really important takeaway from this specifically, is shocking and eye-opening and should kind of guide a lot of our conversations going forward. Also a little bit confused about when you say participation rate, does that mean the families who have Medicaid are using the service? Does that mean families that we've identified that fall within that income range are taking Medicaid? What is specifically the participation rate?
So that refers to the random moment time sample.
Okay.
And so we send out between 80 to 90 every quarter. So in order to get 100%, if we send out 90, then we would want to get 90 back. That would be 100% participation. So out of however many we send out that quarter,
Gotcha.
is we have to get the 75% participation rate. And we're never close to that, thank God, but it will change to 85%.
Which
Yes.
we're already meeting.
We are, but it's also
Okay.
going to change to a 2-day. They have to return it in 2 days. Right now, they have 7 days to return it.
That's a big difference.
And they're inching up to that expiration time, you know?
That's a huge,
It is.
it's a
And
lot of
so-
work to do in 2 days.
Yes, so it's not going to be implemented till August, but the next quarter, we're going to just let them know you have 2 days and just track it to start them getting on it early, even though there won't be any repercussions yet.
And so on the finance team, we're bracing for those changes because if the adoption of getting in compliance happens, there will be some more things we got to do on the back end. And so the finance team is already having conversations about how can we support that. So the 7 to 2 day turnaround, finance is going to be more engaged with working with those at the school sites to make sure we can have that turnaround occur so we don't see our participation rate drop.
So where is that change coming from?
What, I'm not sure what you mean.
That
How are we gonna
participation
roll
change,
that
the
out?
10% jump and the
Okay.
2-day turnaround, what is driving that change?
The new guidance that came out in May of 2023 by the Centers for Medicare and Medicaid.
But if the state isn't following and in compliance about that as far as the fee schedule changing to be 100% reimbursement instead of using fee schedules, how can we enforce some part of the compliance but not the piece that brings in the funding?
So it would be beneficial for us to keep the 7 days. And so if they decide, because we have more days to get that form back, because we're always calling the school or sending an email, we need you to answer the 3 questions and send it back. So it would be better to keep the 7 days, but we're moving to the 2. But if they don't implement it, it'll be better for us. But if they implement part of the new rules, I'm not sure how that works, if they're allowed to implement part.
But
or
who is they? The state?
AHCA. Yes,
AHCA.
the Agency for Healthcare Administration.
Okay.
They are responsible.
So they would be implementing in changes of accountability, but not building in the infrastructure to respond to the fee schedule change that would give us more reimbursement.
Well, they have to submit a SPA. So in that SPA would have changing it for us from our 7 days that we currently have to the 2 days. So if they're not submitting a SPA.
Okay, that's the question I'm
Yeah.
asking for. So it would all come together. Those changes
Yes.
would only happen if they submitted the entire document, and then we moved from the fee schedule to the reimbursement.
I'm hoping. I can't guarantee, I don't know what they're going to do.
In theory, yes, that's correct.
Okay.
Because they're fundamentally changing how
Right.
the program is held in the state of Florida.
Okay. Now, is this something, I understand there's a lot of bureaucracy, but as you've advocated for board members, is this something like the governor could just send out something and force this to happen for us to be in compliance? Does this have to go through legislation? I mean, he oversees our Medicaid office, right? So it would come directly from
Yes.
his office, or who would be more effective, the legislation or the governor, in making this happen?
Probably both. Maybe Kristen would be best to answer that question.
Thank you. Good morning. So we are starting to ramp up some work internally here with some of Deneen's colleagues around the state, Leon County, Broward County, some other folks, bringing in your lobbyists that you know well and getting them up to speed on this. What I can say, I don't really how to say this, but with AHCA is, you probably know, at least with AHCA and the governor, there's also been kind of another issue going on in terms of, with Hope Florida and things like that. So while we're going to still continue to do what we're doing, but I know that's been sucking up a lot of the bandwidth and the
Gotcha.
relationships.
Okay.
So in terms of, so
Okay.
there's a list if you want
Okay.
with the governor.
I'll get with you. I'll get with you
We'll
about
work
that
on that.
afterwards.
Yeah.
Okay.
Okay.
I appreciate that.
Absolutely.
Thank you, Kristen.
One of the things I have a question about is as we look to, and thank you, Ms. Davis, enhance our children who have access to it. And we're talking about, the video is a great idea. I know, and I know there's not consistency, but like when my son brings home a packet, there's always the Medicaid form in his first day packet, if that's something families need to take advantage of. Since I think it was 2 years ago, the state did the purge where basically everyone was forced to re-enroll. And I know that we lost a lot of families on Medicaid during that process. Is there a way to get access to that list and compare it to the families that we have to see the families that didn't re-enroll and make a direct attempt to contact them specifically? Can we cross-reference that list?
Okay.
So there are numbers floating around out there and they call it unwinding. So during COVID, no one lost coverage. Everyone stayed covered. They didn't have to reapply. So then I think it was May of 2023 or April. They started the unwinding. So basically, parents had to re-enroll again. They had to show what their income levels were, fill out an application, and work to get covered. And so what we're seeing what we're hearing are that we lost about 30,000 children. However,
Statewide or county?
Hillsborough.
Hillsborough, okay.
However, working with the school nutrition program, Shani Hall, I think her name is, she had some numbers that I think are way more realistic. So it has each school, and it shows how many kids went from free lunch to paying. So no free lunch. So, and there was about 5,000 students. And there were some schools that I looked on there and I'm like, why is it so high? Like it was a little different. So we're going to use that to target those schools, those neighborhoods, and be able to, look who those families are to be able to enroll them in Medicaid if they're not enrolled, or some type of insurance.
So instead of using a list, we'd be looking more from the student nutrition to identify our families.
Right, because that would give us the most real-time information, whereas because they're already applying in those
Gotcha.
regards for some of the same type of levels that we'd be looking for Medicaid.
Okay, and then I just have two more questions. I appreciate it. I know I have a lot of questions. I heard you mention the number $200 million is maybe just a guesstimate of what, depending on what the reimbursement rate looked like and the new schedule, say fee schedule for lack of a better word, even though I know we're moving away from that. Is that's statewide $200 million is what you're talking about,
That's
right?
correct. Yes,
Okay.
DOE put those numbers together.
Is there a way in our fee schedule study that we could figure out? I'm sure that's what the point of the study is going to be, like what the difference countywide would be. That's part of the fee schedule.
So we've already determined that we, meaning Department of Education, has taken our claims for the last couple of years and already determined how much very large, medium districts are losing or will get later, depending on your perspective.
Sure.
So it's about $10 million for very
Oh, right, you
large
did say that.
districts.
Okay, thank
So-
you. I appreciate
Yes.
you pointing
So
that out.
You're welcome.
we're losing about half of what we're supposed to be getting.
Yes.
And then my final question kind of goes along with Member Gray. I know she was saying, like, in a reduction of Medicare, how would that affect us? And I know that you said, well, we're hoping for an increase in this fee schedule. I think my question is, if there's a reduction in access at the state level, meaning whatever it is for kids to qualify or families to qualify changes, and there's a reduction in access level, that then would have an effect on our county as well, in the same way as maybe the fee schedule changing, but if less families have access to Medicaid, that also impacts us, because you're saying we're going to provide these services anyway, but the families won't have the coverage for us to get anything back. Is that correct?
It's a possibility, but we'll do what we can to enroll these students that have lost coverage. But there's students that are enrolled now that are receiving services.
But I mean, changing to access and less kids having access will hurt us, because again, we're still
Yes.
going to offer these services.
Because potentially less students that are involved in the reimbursement portion. Again, those students would still receive the services, but we just have less kids to get reimbursed from.
Okay, thank you. I appreciate
Yes,
this.
thank
I know I
you.
asked a lot of questions.
That's good. Thank you.
No, thank you. Member Perez?
Yeah, and during that time, we had a lot of families that moved and didn't receive their letters to reapply. and so they got booted off the system. Am I
Yes.
correct?
Yes, that's correct. The different addresses are wrong and
Correct.
things like that, yes.
I think another important note is the state of Florida has changed the minimum wage over the last couple of years and is in the final years of that. And so that changes things too, as we see the base of pay in Florida move up $1 per year. That obviously impacts families, and that also could be a factor in why some of the numbers have changed.
Correct. Superintendent, is there a possibility that we could probably like put a widget in on our website where the families could go on there, maybe a link to the Medicaid application
Yeah,
process?
that's an absolute possibility to do that.
Maybe.
And we'll,
Yep.
Mr.
That
Lewis, if you
sounds
could work
great.
with Ms. Arja, and we'll, kind of work through this, especially with
Absolutely.
moving to our new website system. We're transferring that over now. That'd be an easy thing to do for us.
Because families, looking to apply
a great
for
point. No.
Hillsborough County
Great
Schools
point.
or just looking through our website could probably access that. Our reimbursement rate is how much right now?
So it depends. So we get reimbursed for psych evals, we get reimbursed for counseling, we get reimbursed for nursing, so they're all different rates.
So what's the highest right now?
So for evaluations, we get maybe $48.50
Okay.
per evaluation. I don't even want to say this out loud because the providers will be, not wanting to document. It's not what we should be getting.
Right.
It's a lot less.
And that
than
is
we
at
should
the
be getting.
1998 rate?
Yes.
Yeah,
90
it's about that.
97.
Yeah,
97
it's
rate.
about those. Yeah.
So if, sending our amazing Kristen and, with us speaking to our, the lobbyists and going up to Tallahassee and educating, our legislators, our senators, our congressmen and women, we would move that up to what is the rate that it should be today?
So it's not so much what is the rate, it's how they reimburse us.
Correct.
So hospitals, doctors' offices, when it comes to Medicaid, you're not allowed to make a profit.
Correct.
You can only cover your expenses, and
Right.
that's the same thing within the school district. You can cover your expenses. Well, our expenses are much greater than the $6 million that we got reimbursed last year. So that's really the conversation to have, is that we need to be paid based on what our costs are, not based on a 1997 fee schedule.
Which superintendent, is much better than it was, because the last time we had this workshop, we only had a reimbursement rate of $2 million.
Oh, I see how
Which-
much is
yeah.
reimbursed. Yes, so
So
And
up to,
We're
up to
we're
six.
up to
with-
at least
with-
6.
Yeah.
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 So we're making gains.
Yes, ma'am.
Because we're bringing an awareness, and thank you so much for this
Yes, you're welcome.
this workshop and the awareness that you're bringing, and how much it's really impacting our students and the services that we bring to the table for them. Because with this, being able to. But my thing is, when you're looking at those 5 states, Florida being number 1 on there, can we mimic something that those other states, like you mentioned, are doing differently, that we could possibly do on our end today that would maybe turn this around for us? Or is it at a state level the only way that we could change this?
It's at the state level. That's the only way it can be changed. However, we have met with those other states, like I said, and so has ACA, believe it or not. They finally have come to one of the national meetings, and they've met with Michigan, the person at Michigan who runs the program there in cost reconciliation, so they can create a SPA, so they can learn about it. So they have done the work. I don't know what happened, where they are, why we just came to a standstill.
I think that's why you see other districts in the state of Florida and these other states, what they have done is the only leverage and change that we can control is a rate study.
Yes.
And so we'll do that for our services and provide that. Ms. Deneen mentioned that Levy County just did one for transportation and was very successful in it. She has experience doing the same thing at her previous district. And so, but we believe that's the stopgap that we can do, that we can get our rates at least somewhat right-sided. From the 1997 scale. Things have changed a lot in that time period.
Terrible.
And so we're going to work on that. And that does, just to make you aware, that does take a little bit of time. That isn't
Yes.
something we can do overnight, but we've already started planning for that. We'll attack that very aggressively, but it does take some time. Then it's going to take some time for that to show an impact. And so I don't know if this next fiscal year we'll get all of that done where we can see a significant growth rate, but there's a process that will begin, and because we still have to file the documentation with the certain different places to show the rate study and how we came to those rates and get it approved. So.
Yes.
Even the mental health need of our students in our district has changed drastically, and providing those services to them really has but will you let us know, all of the board members know, when this rate study is going to start, so that way we can keep an eye on this, please?
Well, it'll start probably next week.
Yeah,
Okay.
we've already identified the potentials ones we want to start. We haven't finalized our process for that, but we will begin immediately next week with at least selecting the first one and going after that, and then continue working through a priority list.
Fabulous. And could you let us know if it makes a difference? If you don't mind?
Yes,
Thank you.
absolutely.
Thank you, Member Perez. Member Gray?
Thank you, Madam Chair. I appreciate the board's comments very, very much, especially as it relates to what can we do as board members to get to our lobbyists and to get to our legislative folks, and their education also with what you're giving needs to be equal. So those discussions will probably help greatly. My argument or my dilemma, this is as an individual school board member, in looking at possible reductions and the impact those reductions of Medicaid will have. And I would like Mr. Lewis, if you could go ahead and give a percentage. I gained these percentages from another district. There's several categories. Member Perez, you mentioned mental health services. That's going to also impact. It's going to impact specialized ESE instructors. It's going to impact physical health services. It's going to impact prevention and early intervention services. It's going to impact the actual referral services from the care coordinators. It's going to impact the Medicaid outreach and enrollment services. It's going to impact student resources, technology, equipment, and transportation. I think that's going to be important. Now, ideally, we're not going to see any difference, or maybe we'll even have more money. But that's not the reality that I'm reading, and not the reality that other school districts are looking at. They're looking at a decrease. And with the SPA and all the great intentions that we have, I think the reality is we need to be prepared for an impact of reduction, because we cannot be blind to what probably we will be reading in the newspaper quite shortly. There is budgetary situations going on that will reveal a decrease in the Medicaid department, aside from what you're already sharing. So that's my ask. But one curious question: how do charter schools? How does it interface with charter schools in terms of the Medicaid? We didn't mention.
So charter schools have been able to use the school districts in the county that they're in. So the charter schools in Hillsborough County could use our Medicaid provider ID and use our system and provide services to students and submit claims. So, and that would be with an agreement with the school district. Currently, the state of Florida does not have any school districts that allow the charter schools to use their provider ID number. We have a few charter schools that recently, since 2020, when they the governor added charter schools and private schools on, we now have probably 5 or 6 charter schools that are got themselves enrolled. Okay. They have their own provider number, and they bill Medicaid on their own. Yes, so it's still, everyone's starting to build up the infrastructure to be able to do it.
And that's a good thing, absolutely.
Yes, it is a good thing.
Yeah,
Yes.
and the follow-up question too, when we talk about self-insurance, Aetna, for example, how does Medicaid interface, if at all, with our self-insured status? Anything at all?
No relation.
No relationship at all? Okay, all right. Thank you, Madam Chair.
Thank you, Member Gray. Dr. Hahn?
Thank you. I know we all want to try and predict what's going to happen to Medicaid or Medicare in the future. But, let's not forget, in 2023, millions of families lost their Medicare coverage. And so, it's been an ongoing problem regardless of the administration. It's not been funded to its potential. So with children that are in the CHIP program, do we get any reimbursement for that?
So currently, we do not. However, in the May 2023 federal guide that came out, it says that we can get reimbursed. So hopefully, they're going to implement that. There's still some issues with CHIP. I have asked that a lot of times. We don't check eligibility for any CHIP students, and so that's where it would have to start. And they're not really talking about they don't want to grow the program, the Agency for Healthcare Administration, because that would mean more work for them and make it more complex. But the federal guide says we can.
And because the children that are in the CHIP program, they make more, they make too much money for the Medicaid program, correct?
Yes, that's correct.
Excuse me. So I know that we enroll, we try and enroll as many students as possible, but when children are being discharged from hospitals at birth, who have high medical complications, they're being enrolled at that point in time also in Medicaid.
By hospitals, yes, that's
hospitals.
correct.
I remember I worked in a NICU for years. I remember doing that at discharge, not me enrolling them, but I
Right.
remember that being part of the discharge process.
Yes.
And then also fiddlers, if they're screening kids and they're identifying children, would they also be a touch point to enrollment?
Absolutely, yes. And I'm
Okay.
working with Stephanie Friedman over there. She's amazing, and
Yeah.
she has, she's all on board. Yes.
And then obviously when students come to us and they're identified for ESE programming, then that's when we step in and I would imagine during IEP meetings, especially the initial one, we are encouraging parents to enroll. Obviously, we can't force them to, but, we would be encouraging that. We would provide information during that touch point. Okay. So I appreciate the action steps. I think, hopefully, when we talk about our legislative platform for next year, which we should probably be talking about very soon, even though session's still going on, that we would want to include this in our platform and kind of galvanize many other districts through your points of contact to, get them to also put it on their platforms, and then perhaps through the superintendent and his superintendent conferences that he attends, perhaps trying to set up a meeting of superintendents to discuss this, maybe one of you going with him to really, whether it is having a lunch with them, but trying to galvanize as many Florida superintendents as possible around this issue. So I think there's many of us that have to walk away today with action steps to really, get enough people around this issue from different points of the education arena. Thank you. Thank you for all the information
Thank you.
today.
That was great.
Thank
And the
you.
way you presented it, because I didn't know a lot about it. I knew very little, and I feel like I've learned a lot through
Thank
just how
you.
you kind of dumbed it down for us.
Ms. Deneen does a great job for us. When I acknowledge that the staff in the finance department are working really hard at this and very passionate, as you can see, and excited for the opportunities we have before us.
Yes.
Well, I appreciate all of my fellow board members' comments. I feel like today was a really good discussion. I just have 3 quick questions. How long, I know you said that this study, you anticipate it being a lengthy one. What's the timeline? Obviously, it's not a hard and fast one, but what's the general timeline that you're anticipating?
So, go ahead.
I would think from probably 3 months. By the time we get the committee together, we get the data together, we have to determine what data we need. We have to determine the right people that should be there, pull the reports, and then we have to pull it all together. It has to get sent to, guess who, ACA, to get approved. So how long it takes for them to approve it, I'm not sure.
So 3 months is optimistic.
Yeah.
Yes, and I would say different studies or different timelines.
Yes.
For example,
That's true.
transportation will be probably one of our biggest opportunities, but take also the most time out of a lot of the other types of
So
studies.
it's also going to be segmented by different.
And we'll be working on multiple studies at the same time.
Okay, that's helpful. One of the other questions I had, I know that Member Perez was trying to get an idea of the difference in fees individually. So we used an evaluation as an example of maybe getting $46 reimbursement. But I think the question is, if we were, getting on the fee schedule, if it was a full reimbursement, how much does it cost to do one of those to compare those two?
How much does it cost to do, I'm sorry, a rate study?
So if you were saying, no, for the evaluation,
Oh, I see what you're saying. Yes.
you said we got about $46.
Yes, I understand.
If we were getting 100% reimbursement, what would that look like compared to the $46?
Well, that's what we have to determine. So
Gotcha.
we'll pull all
So we're
those
not sure
reports.
yet.
And no, I
Okay.
don't know
We
yet.
can provide feedback to the board as we
Okay.
go through this process to kind of show what our study determined and the outcome.
You can't compare
Yes.
private practice.
And then my final question is, as we talked about charter schools, thanks for bringing that up. For the evaluations that we do for charter schools,
Yes.
are we using our ID number for that, our Medicaid ID number?
Yes. So
Okay,
when
so we are
go-
getting reimbursements for charter schools if we do the evaluation.
Correct.
Because we're providing our Medicaid ID number.
Yes,
Okay.
we do that. Other districts may not, but since we have the expense, then we get to claim that service. That's how we look at it. So yes.
That's helpful. I don't have any other questions. I think board members, are we good? Okay. Well, seeing that, this workshop is adjourned. Thank you.